For the past several years, the City of Bloomington has been actively engaged in trying to keep IU Health Bloomington Hospital as our downtown hospital. The administration and council members have reached out to the hospital and provided a variety of different alternatives that could improve infrastructure to allow them to stay. I can tell you that I've met with leadership of Bloomington Hospital to ask, what more can the city do? You are an important part of our city's downtown, and we've been met with the same response that other council colleagues and the mayor have been met with, and that's, we are making our decision now. Well, we've heard from the hospital. They announced that they think that they cannot build on their current site. And the implication is they're going to move elsewhere. And this puts us in a moment of accountability that we must re-engage with the hospital, and the hospital has agreed. Mayor Mark Cruzan put together a hospital site reutilization committee that I'm proud to be a part of. And in this process, working with people that I've developed good relationships with over the past 3 years on council, 2 of which was I serving as president. And in these conversations, I think one of the starting points that we must emphasize is having Bloomington Hospital, IU Health, make the case for why they cannot stay in our city center. Now, there are a lot of issues that are going to be discussed because there are impacts that go beyond the hospital itself. There are so many ancillary medical services that are supplied in that area that will likely go the moment the hospital decides to leave as well. And that risk of a blight, a brownfield in our downtown, is a major, major crisis that the community must be able to address. And this is where Bloomington Hospital needs to be a community partner. They have to be at the table and have entered into the discussion on how they're going to help reinvest in that site to ensure that our downtown doesn't go the way of so many other cities that have seen hospitals move from their city core. Richmond is a great example. Richmond Hospital has sat empty, and this empty hospital is going to cost the taxpayers of Richmond nearly $6 million to even just tear down that site. We don't want that same situation. And we're going to be asking Bloomington Hospital to be an active partner to ensure that that doesn't happen, because that area cannot fall into a brownfield state. Now, this also is an important opportunity. If we reach that time where the hospital says they are leaving, then we have a possibility to reimagine what that area can be. And that's an important conversation for our community to drive forward. And that site reutilization committee will be leading and driving those discussions and ensuring that those discussions are brought to the citizens of Bloomington, because you deserve to know what's going on. You need to be a part and engaged in that process, and we'll be working to ensure that that happens.